No,
I'm
you're
good,
good.
yeah.
You're good. You're good. I don't think you.
I'm just can't wait for the end result. I think is the most important thing for me.
Yes, the end result. You will see the change, of course, in the beginning, what we are doing, but end results really take some time. I say this kind of nose 1.5 years, maybe, but I repeat again. Sometimes I see my patients 4 years later, 3 years later, it still has some change. It's about the skin redraping. Skin thickness is the has the major role in this healing. This is, for example, thick skin. You can think like that. Okay, this is thick skin. You don't see what's under it, and this is thin skin. So it redrapes better, redrapes faster, but this takes a little bit more time. So what we call definition is what you see under the skin. Okay, so the definition occurs with. There are two things you can do. You can make this part thinner, and you can put something stronger.
Yeah.
So what we do in the surgery basically is both rib cartilage for putting some stronger things and some skin thinning we do. Actually, your skin was not very thin, thick, sorry, but this filler, you put fillers between these layers. So your skin become like that. So we will remove it, and then we put something under it to support it.
And how long is it going to take you to dissolve the fillers before we do the surgery?
Actually, in practice, they cannot dissolve the fillers.
Oh, you can't dissolve it? Oh, wow.
Theoretically, it's yes, you can dissolve it, some of them, but it's not successful because there's some capsule occurs around that filler, and you need to take it out. Even you dissolve the fillers, it's good to take. You need to take it out. I say you can try it like 3-4 weeks ago before the surgery, but in the surgery we physically taking out this capsule, so it causes also swelling.
Okay.
Just nothing to do now, so we need to concentrate on the good one. Okay, it will be nice with time. Here we need some support. I'm going to put some rib cartilage here, just the tip part, so it will be like a more strong and more definition it's going to give. Your nostrils are not too wide.
But I want my nostrils smaller.
Yeah, you have very tiny nostrils, so even we do, maybe we can do like a millimeter smaller, but I'm just going to do this part and tip part, then we call the nostrils. The problem about the nostrils, what you complain when you smile, it gets wider, is mostly about this part is weak. So we need to reconstruct and make this part more strong, so it's going to prevent its excessive flaring. But this flaring occurs with your muscles. There are muscles, smiling muscles here, and these all, when you smile, it all pulls down. So whatever you cut here, you still smile and it will go like that. So to make this part stronger, it's going to make it less. Yeah. If you want additional less flaring, which I recommend sometimes to my patients or someone who doesn't need any surgery, if you do just 1 unit of Botox each side, you cannot flare your nostrils too much.
Yeah.
If you can, but personally, I don't think that it's looking bad or something like that.
Yeah, for me it's okay.
Your smiling is very beautiful.
Thank you.
Yeah, so I do not recommend so much in your case, but if there is something you need to do, it's Botox. Yeah, so if you want additional, less flaring.
Yeah.
That's important because the cutting here doesn't have so much role to prevent it. You still smile, your tip is flared, but to make this part stronger, it's going to improve that. It's going to, yeah.
And in terms of like my side profile, like how high would that go from here?
This part is hanging a little bit, so we make it a little bit like that, and it will be good. So it will increase like that.
Okay.
You see. So what we do basically also in this surgery to give projection to tip and the bridge at the same time, so it looks proportional. So when you do here very high, it's very low, it doesn't look well. So when you give projection here and not making this part, so this part will stay so low. So there's a correlation between this height and here. You see, when I make this, it holds your skin, this outer part skin, in more central position. That's the definition. That's the thing that when you do with the contour makeup also.
Yeah.
What you do in the contour makeup, you erase the sides, erase the sides, and you show the center part of the nose. It's surgically we are doing that.
Yeah.
What we do, we lift the side skin to central position by lifting up. Cutting these bones, because these bones are short, does not give this effect. When the nose is high, for example, this is nose bones, okay? So when you cut the nose bones from side, and they come together, but when they are short, like this, for example, they don't come together. So you add some rib cartilage here to have this contoured effect. That's why we do bridge augmentation. When I take out your fillers, probably it will be so low, so we are going to augment the bridge. Bir kalem alabilir miyim? Sorry.
Okay.
This will be the new place that you can look from the mirror, that your new nose is going to start. This is the starting point. Plasty to make your nose look more higher. And for the narrowness effect, is happened by this osteotomy, which makes narrowing the nasal bones, plus augmentation of the nose. Okay.
And if you go too narrow in the nose, like for example, like I have a friend on her nose, she did a nose job and she did it twice, but it's too narrow. So like if I go too narrow, is that gonna cause like any issue in the future with the nose or breathing? Or...
If it's too narrow, it's not good for breathing. But this problem happens mostly when they take out the bones, but we don't do that.
Okay.
When you excise the bone from there, it will collapse. But we don't do that, the first. The second bit, we use rib cartilage for reconstruction. So we make reconstruction, so we don't expect that kind of problem. Okay. So when you try to make a nose smaller by cutting it, it causes problem. When you augment, reconstruct it, it doesn't cause this kind of problem. So, like taking like a Michael Jackson nose, don't take it out so much, etc. It happens by reduction of the nose. We do actually augmentation, reverse of that. Okay. Just the augmentation, and it gives like more sharper look to nose.
And if, for example, if I get pregnant in the future or anything like that, is the shape of my nose going to change in any way?
In the pregnancy, because of the blood circulation increase and gain weight with hormones, of course it's going to get bigger, which is normal. Yeah. Then it became again the same. Okay. So, of course, it's very individual. You have like that kind of structure. I have patients, by the way, that get pregnant, of course, after surgery, but then the shape come back again. Just it's about the hormones and how much weight you gain. It's happening very different for each person. So also it's affected by that.
Okay, cool.
Yeah. Yeah. So we can talk about the plan of the surgery also. Again, like there are two approaches: closed rhinoplasty and open rhinoplasty approach. I do both of them. If the septum support here sometimes is very weak inside, so I can use open rhinoplasty. In your case, I can decide in the surgery for you. Just first I want to remove this fillers.
Yeah.
When I do open rhinoplasty, if you can hold the mirror, I want to show. Actually, probably you know this, but we make a small incision on the columella, like this kind of incision on the columella. So it's the way that how you enter the nose. Actually, basically, we are doing the very similar same thing, and what we do inside is mostly same. And we do surgery, like we come here, we cut these bones here, and we shape with stitches and supporting techniques with rib cartilage. And nostril reduction, we make these incisions just in the base of the nose, and it's very important point. I always tell patients and also doctor's friend, this part leaves a lot of scar in the nose. So I recommend not to cut this part because these scars are more visible. But these scars are really less visible. And
am I doing an open or closed rhinoplasty?
Okay, I'm going to tell. Just want to explain one thing. When you cut here, this part, it makes this kind of nostrils, which look very unnatural. So what we do here, we bring them together. When we make nostril reduction, it makes nostrils still round but smaller. Again, you don't have so much nostril problems when you think like you have, but it's not too much, at least for me. And also your nostril size, it's not too big. So the breathing issues important when it make so much nostril reduction. And in normal nose, natural nose, these nostrils must be a little bit wider than this part to make it natural. So now your nasal bones are wide, your nostrils become less wide. So we need to make this part narrow first, then we will see how much we need to take out from here. In your case, I am telling you, we can do open or closed rhinoplasty. I'm going to decide after removing the filler. So after removing the filler, we will see the skin itself. If it's too weak here, this part, I can do open rhinoplasty. If it's stable, more strong, I'm going to do closed rhinoplasty. Because probably they do have a lot of injection here too. I can feel it.
Yeah, I believe I do because I remember I did see that. I want it very prominent.
Yeah, that's why.
It's only one nail. It's only one.
But you know, we will see. We will see. We will see here. Okay. Yes.